Hi guys, so this is the video that I was supposed to post like 2 weeks ago, not that we're counting, um, just about like the day of testing that we had after we got our diagnosis and everything. It ended up falling on Good Friday, so it was about like 2 weeks afterward. Um, so I guess it might be a long one, we'll see. So the day that we went in was a Friday, and it was my mom and I, and we had to be at the hospital, at the children's hospital at like 6:15, 6:30 in the morning for an MRI. That was the first thing we did. I have never had an MRI, and I got up that morning thinking like, oh, thank goodness, like, I've heard all these, I've been asking for like a week now, since we scheduled this appointment. I've been asking people like who have had MRIs, what's it like? And like I've heard people say like, oh, I fell asleep, I slept through it. So I was like, okay, cool, yeah, it's at the crack of dawn, but I'm just gonna go back to sleep. Yeah, no. Um, they gave me headphones and I listened to the radio, but it was still so loud, and like it was just, there was no sleeping, there was nothing. It was just sitting there through this like noise, and I'm just like so tired. And then like the lady doing the MRI, she wanted me to be like as still as possible, which I'm sure is like routine, but also I guess because they were like, he was moving and stuff, so like as they're doing it, like he's moving around and they're basically like chasing him and stuff. And the purpose of the MRI was because they wanted to get like a better view of his duodenal atresia, to figure out exactly what we were dealing with, and that sort of thing. So we had that done, and then after the MRI, we had to go up to the cardio floor, and they did a fetal echocardiogram over there, which was basically just like an ultrasound, except that like they had like a doctor and a fellow in there, and they did like the actual like scans and stuff, or the doctor, the one did. And then so she went to talk to the heart surgeon, and she let him kind of like look around because he's a fellow, so he's like learning and figuring it out. And it just like kind of, I don't know, I guess I was agitated just because I was like, I'm gonna be poked and prodded all day and you're bugging me. But he like was doing he was doing it, and I mean, he's in the cardio area, so he should be looking at his heart. Well, then he's like, oh, look, there's his toes. That's so cool. I'm like, yeah, that's his toes. Like, aren't you supposed to be looking at something else right now? Like, so I was just kind of like, I don't know, it was weird. I was like, have you never seen an ultrasound before on a baby? Like, it was strange. So anyway, he was doing that, and then the other two, well, the surgeon and then the other doctor, they came back in and they kind of talked to us about exactly what we were, what they found and everything. They said it was a AVSD, an atrioventricular septal defect, a complete. Now, I kind of already knew this. because I'd been doing, since they told us that he had a heart problem and that it was common with Down syndrome, and had kind of told me like very basic information from the ultrasound. Ever since then, I like started looking like online, looking up information. There's actually a really awesome app by Children's Hospital. It's called Heartpedia, and I'll try to remember to put a link in for that, but it's a really awesome app, and it's got like 3D models of like common heart defects, and it had, of course, the ABSD on there. And when you pull it up, it's got all the different like defects listed, and then you click on the one that you're, you know, wanting to know about, and then it's got different tabs for like just information, and the information section was amazing. It had so much information in it. And then you can go over to like the you can go over and look at like the 3D model, and the 3D model was really awesome because you can like flip it and spin it and look at all the different angles of it, and it actually has like 3 different tabs, so you can look at like what a normal heart should look like and all those views, and you can like look at it like cut in half, like vertically, horizontally, or just like full in different ways. So because of course different defects are going to be like easier to see from like different cuts or different angles. So you can look at like the normal heart and then the heart with that defect, and then you can actually look at it with the repair, and it shows like, you know, like the patches. It shows like a white patch or whatever in the section that they're going to be like repairing, and so you can kind of see like exactly like what is going to be done. And of course, like it's nice that in the information section they like tell you what would be the repair, but then you can actually like see it on the model and spin it and like look at it at different angles and see exactly what's going on. So I just thought that that app was like super helpful, which is funny because so that day they gave us like, I ended up with this huge stack of information, and if I'm not mistaken, I believe it's this one. Yeah, they actually gave us like this packet that if I can find it, this card was in it, and it's like, that's what like the symbol looks like for the app and everything. So it was really cool that, you know, they were talking about it, and I kind of, you know, already had it and already knew about it, and they gave me some like other information and stuff like that. So the other thing that they gave us that was like, I found really awesome, kind of touching, was they gave us this little bag. And it was like a cinch backpack type bag, and it was from the Little Mended Hearts association or foundation, and they just like, it had like little packets like this in it, and some business cards and stuff like that, just to give information on like what they do and things like that. But then also like inside the bag there was like this little like sandwich bag that had like chapstick and hand sanitizer and lotion, and I want to say something else in it as well. So that was really cute. And then there was like there was this, so there was this book called It's My Heart, and it says it's the world's leading guide to congenital heart defects for parents and patients. So I thought this was really cool because it's got, I mean, obviously it's got more than just the ABSD in it, but it's got like, there's a huge, in the back here, there's like a big glossary of things, like if you have no idea what the heck they were talking about. But then there's like the different defects, and it's got like the information, but then it's got like actual like normal heart versus defect. So it's kind of cool to see like the different images of it as well, which is really cool. So, and it says Children's Heart Foundation at the bottom, so that was a really cool book to have. And then the last thing that was in the bag, it was so cute. It's this little like hand crocheted, I think it was crocheted, I'm pretty sure. But it was like this little handmade red like newborn size hat, red for congenital heart defects and everything. So it was really, really cute that, you know, somebody took the time to like make those for these bags and stuff like that. And the bag said Bravery Bag on it, you know, so they can give it to like the parents and the children and stuff like that. So it was really cool. So after the fetal echocardiogram, we had to go over to my normal doctor's hospital and have a ultrasound done. The main reason that, I mean, we'd already had 2 done, but I was transferring from my regular doctor over to the high-risk clinic at that hospital. So they wanted to do an ultrasound of their own, which, I mean, I guess makes sense, even though like they had all the scans from the other hospital and from the doctor, but they wanted to do their own ultrasound. So we went over there and we had the ultrasound done with them, and thank goodness I had time to like grab a bite to eat. And then we went back to the children's hospital and we had to go up to their fetal care center. That's what it was called. So we had to go to their fetal care center, and they basically like put us in this room that was like, it was like the size of like a delivery room, but like of course there was no bed, like hospital bed in there. There was this awesome reclining chair and a bunch of other chairs, and there was like a TV and things like that in it. But they put us in there, and then they pretty much like proceeded to like one by one like bring in different people to talk to us, which I knew that we were going to have meetings for the rest of the afternoon, but I had no idea that that's how it was going to be. I thought it was going to be the way it was all morning, where it was like run here, run there, drive here, drive there, go back and forth. So it was kind of cool that it was like, yes, now we get to like just let them come to us. So from there we met with a social services lady, which she really didn't really have anything for me that I needed. I have my own vehicle, so I didn't really need to talk to her about transportation to appointments, and I mean, pretty much everything like that she asked about, I pretty much already, you know, had taken care of. So we talked to her, then we talked to like a regular like midwife that I really, really liked, and they said that she doesn't deliver anymore, which is unfortunate because I really, really liked her, but she was really nice. She answered a lot of our questions that we had. And then we met with a geneticist, which was really cool because our first geneticist that we spoke to was at a different hospital. That's the one who like was there and talked to us about the amnio and everything when we were first finding out, and I absolutely adored her. I actually saw her when I went to the Down syndrome conference a couple weeks ago, and it was really cool to see her again. It was funny because she was like, I know you probably won't remember me until I tell you, and I was like, oh no, I totally remember you. Like, it's one of my favorite people that I've like had encounters with since, you know, this whole thing started. But so she had already told me about this new geneticist that we're now dealing with at the new hospital. So that was kind of nice. So we met with her, and she was, you know, she was really helpful and everything as well. And then from there, I want to say that was the last one. From there, we turned around and we went into a conference room. Now, this conference room was like a team meeting, and this was crazy because this was the meeting that like I knew was coming. I knew that like all the testing we had done all day and, you know, everything that we'd done all day was basically leading to this meeting to like find out like more about like specifics and everything. So this was the point, like when they were getting ready to take us, I was like, okay, deep breathe, deep breathe, deep breathe, because you need to control your emotions and not like fall apart. You need to like absorb all this information and you can fall apart later. So we walked into that room, me and my mom, and the geneticist is actually, she walked us into it was like a big conference room, and like down on one end there was like a big projector, and then there was a big long table, and then there was like 4 chairs on the other wall. So on the other wall there was 4 chairs and there was 4 people, and I don't really know who any of them are or what they were doing there. I know that like one of them was kind of like staring into space, like, why am I here? And then one of them was like on his phone the whole time, not paying attention. One of them seemed really attentive. And then there was, well, so 3 of them were guys, and then the one female, I couldn't really see her because there was someone sitting at that end of the table that blocked her. So I don't even know who they were really or what they were doing, but they were there. So then on top of that, we also, like, the table was full. I want to say there was like, when all was said and done, there was like 11 people in the room. So there was those 4 plus my mom, myself, the geneticist, and then we had a woman from my OB. There was also a guy that was from there as well, but he was basically just like typing on the computer and like changing slides on the projector, so I don't really know why he was there. So then there was somebody there to talk about like after he was born, like what would go on and stuff like that, and kind of talk about procedure from there. There was another guy there to talk specifically about like his stomach blockage, and then there was 2 ladies from the Thomas Center for Down Syndrome also there as well. So it was a very full table of people. So they started with the woman from my doctor, and I've not seen her, but I know that there's like a lot of doctors at the high-risk clinic. So I don't know. I haven't really seen her, but I guess she had to go. She had to leave early for something, so she went first, and we went through all the MRI scans. And she kind of talked to us about those and told, you know, us what she was seeing, you know, that everything basically looked normal. I mean, other than, you know, the issues we already knew about. Everything else looked fine and looked to be progressing good, and it was really weird. I've never seen an MRI. I don't even think I've seen an MRI like on the internet or anything, but it was really cool to see the imaging and stuff, and she was kind of showing like, here's the baby, and here's like, this is your spine, and this is, you know, it was kind of neat. So she kind of went through all that, and then she told us that with the stomach blockage he's got going on, that normal babies will like swallow amniotic fluid in the womb. They swallow it and they digest it, and that's like what fills their bowels before birth and stuff. And that's like, I guess that's like how they taste, like what you eat and stuff, you know, like they say if you eat a lot of like salty or sweet or whatever, I'm pretty sure it's like it's affects the amniotic fluid, and that's how they like, you know, taste that and everything. It's from the swallowing of the fluid. But so the problem is that with his blockage, he can't digest it, and so it basically just fills up his stomach, and then after his stomach is full, it like fills up around him, and that's why like the fluid's high, because he's not like digesting it, it's just building up around him. So she told us that, and then she said that sometimes like this causes complications because it causes the uterus to like overstretch, and sometimes it has problems after birth like going back down, because I guess even after birth, like, I mean, the whole point of contractions, like when you're in birth, I mean, other than like of course pushing the baby out, but it also, it like it's contracting, and the bleeding and the contracting is like part of its process of like going back down, and that's why you like continue to like bleed after birth, because it's like part of its contracting to go back down to normal size. So she told us that sometimes there's like problems like when there's all that extra fluid going back down to size, and then they have to do like a hysterectomy and just get rid of it all. So now this is my last, so I mean, I was kind of like, okay, okay, fine. If you have to do that, then you have to. So she finished talking, and then they moved on to one of the surgeons that was there to talk about like his just like after birth and stuff like that. So they told us, or he proceeded to talk to us about like the fetal echocardiogram, and so he didn't go into a lot of detail about like the heart and stuff, because we had already talked to the cardiologist and he wasn't one. So but he did tell us that we're not looking at surgery until like 4 to 6 months, and so that was kind of good to know, that it wouldn't be like an immediate thing, because I figured that would be like something like super serious that like would have to be done immediately and everything. He said it wasn't, and that wouldn't take too long. He did tell us that within 24 hours of birth, he would be having his surgery for his duodenal atresia. Now, he said within 1 to 4 hours, he would be transferred over to Children's Hospital, which is only like a 5-10 minute drive tops from the hospital I'm delivering at, which has a level 3 NICU, which is also another reason that I've transferred over to the high-risk clinic there, because of their NICU. But that was something I hadn't really thought about. It was something that I hadn't quite considered, the fact that like, well, duh, he's gonna have to like go over to this other hospital. But I don't know, I hadn't thought about the fact that I'm still gonna be in the hospital. I'm not gonna be able to leave and go with him. I'm gonna be stuck there while he goes to this other hospital. So that's still something that's like processing, and it's a little hard, and it's like, so then they asked like, have you put any thought into who's gonna go like with him over to the other hospital? And I was like, oh my god, no, I haven't even thought about it, because I hadn't even thought quite that far, but because I didn't really have the information of when and timelines and things like that, so I didn't really know. So that was another thing that I still haven't figured out, who's gonna stay with me and who's gonna go with him. I'm still trying to figure that one out. I mean, we do have time, but I guess I should probably figure that one out. But then he told us, so he said within 1 to 4 hours. I did ask about it. He said as long as there's not like a bunch of complications on my end, because I'm at the high risk clinic, but technically I'm not high risk. It's the only high risk part is him and his, you know, and the Down syndrome and the heart defect and the stomach defect. Like those are the high risk portions of the pregnancy. It's like not me specifically. So, I mean, normally after birth, you're in the hospital for a couple days, but part of that's because they're like monitoring the baby. And he said that, I mean, since he isn't going to be there, he's going to be at the other hospital, then I should be able to be discharged within like, or after like 24 hours, I should be able to get out of there. So, praying for no complications. For me, and he said if not, then they can usually get like a 4-hour pass for me to go over there and just say like, you have this amount of time, and as long as like you're not having any of these like symptoms or any like serious issues, then you know you can be over there for that time and then come back. So praying for that. But that's the point where all of a sudden I was like, crap, this lady said like there could be issues and I could have to have a hysterectomy, and that kind of stuff would like keep me in the hospital even longer, in which case like I wouldn't be able to get discharged and be over there all the time. And so that's causing a little bit of worry for me now. I'm just hoping for the best. At this point, we're not really having a whole lot of complications. I'm hoping that like this cramping that I've been having lately from the extra fluid is not a sign that we're gonna have future issues, but we're just hoping for the best. So that's when I started worrying about that a little. But then he kind of went into more about, he said because of the blockage, they're probably gonna have to like feed him and get him nutrients and stuff through like an IV and stuff like that after birth. But the problem is that with like little babies like that, they have like, they can only use like the certain lines or whatever for like a couple hours at a time. So they have to put in a PICC line. And basically, like from what I was told and what I've read, that's just like, it's like an IV, but it like runs all the way up the arm and like goes closer to the heart, so they don't have to worry about the extra stress on the like vein itself. So it'll just get closer, it'll be closer to his heart to give him everything he needs and stuff like that. So basically, lots of tubes. So then, I mean, that's pretty much all he really discussed, but then we moved on to the guy who kind of talked to us more about like the actual surgery and all of that for correcting the duodenal atresia. He, it was funny, he actually like got up and came around the table and there was a dry erase board behind us, and he like drew everything out on the dry erase board for us to kind of like explain exactly like in picture like what was gonna happen, how they would fix it, you know, everything, which was really like a helpful way to do it because I'm a very visual person like that, and visual and hands-on, so like seeing him do that was easiest for me. So I don't think I've really gone much into detail about duodenal atresias. Basically, your duodenum is between your stomach and your intestine. It like connects them. So, and atresia basically just means that like there's a blockage. So he's got a blockage there that's preventing the food from, or you know, fluid or whatever, it's going to prevent it from moving to this, from the stomach to the intestine, so he can't digest or fully digest and process through it. So he kind of drew us a picture to show us that, and then he showed us, I guess, the plan. You know, he said it could be just that in forming the duodenum isn't open, it's just closed, or it could be that like the pancreas for whatever reason grew around it, so it's basically like pinching off the duodenum. And he basically told us that they would basically make an incision, and they would cut like above the blockage and below and connect it, and that would allow it to like go through. And so he said that that is normally like the actual recovery on that is only like a week or two, but he could be in there for like a month, depending on how he takes to eating, because of the fact that you know, not being able to eat normally. They're probably gonna have to feed him through a tube for a while he's recovering and stuff, and not being able to eat normally sometimes causes them confusion or causes them problems taking to bottle feeding and things like that. It takes a little bit more time, in which case it could be like more time in the hospital. So we're gonna see how that goes. It's kind of a waiting game because we don't know, you know, there's no telling, like, is he going to take to it or is he not, or, you know, that sort of thing. So that's what we found out as far as that part. He was really awesome and informative. And then the geneticist didn't really have much to say because we had just met with her. But then we moved on to the 2 women from the Thomas Center for Down Syndrome, and they were really nice. They gave me like another folder full of information and stuff like that, and kind of talked to me about different things. And the thing is that like most of their services are like on the later end. They're like a little bit further down the road as far as like helping with just, you know, like therapies, like speech therapies or physical therapies, or, you know, different facilitation of different things like that. But she was they were really nice. Both of them were. It was really cool. I saw the one at the Down Syndrome conference as well, and she recognized me, and she was really nice. So it was funny. So my mom went to a conference last weekend, I think I mentioned, and she met with a woman from the Down Syndrome Association and gave them my information, and she actually called me yesterday, so to give me more information and books and stuff. So that was cool. And her name, like when she told me her name, I was like, gosh, that sounds familiar. Why does this sound familiar? It's because when we met with those ladies from the Thomas Center, they actually they mentioned her, and they mentioned that she was a mom, and, you know, all that, and she would be really understanding, and she has the same number of kids. And so it was really cool. You know, I was like, oh, that's why I remember her name, because her information is in my folder that they gave me. So from there, I think, so when we went to leave, that was pretty much the end of the meeting. When we went to leave, one of the guys, the one that I mentioned was like really attentive, that was sitting against the wall, not at the table. He kind of approached us and was like, hey, I was wondering if I could talk to you guys for a minute, you know, just about something real fast. And he introduced himself and told us he was also from over at the high risk clinic. And I actually didn't have him for my appointment yesterday, but I saw him. So I was like, oh, cool. I recognize you. So we went back to the room that we were in before when everybody was coming in to talk to us. And he sat down and kind of talked to us about the fluid thing. So I guess he said the woman that had talked to us originally, the first lady that spoke in the meeting, she specializes in high risk pregnancies and high risk deliveries. So he felt like she kind of just like jumped into like, oh, well, if this happens, you need a hysterectomy, and that's that. And didn't really give us like as much information as she could have. So he went on and told us that I guess there's other options. There's like medications they can give as well, and they usually try those, and they usually like those most of the time work. They also have this like weird balloon thing that like they fill with water and then they can like deflate it, and it helps like with the contracting down and stuff like that. So he said like usually those are like those work, you know, if there are complications with that, those are, you know, those work. And so that was really comforting for me, because I was like, oh, thank goodness. So I might, you know, if there is an issue, I may not have to stay in the hospital longer. I might still get on time if there's a problem. And it won't be like, oh, we're just going to take this out and have surgery and now you're stuck. So that was comforting. But he said he's been part of over, I'm going to say 500 deliveries, and he's only seen one of them have to have a hysterectomy like that. So, I mean, you know, that's comforting. And it was just, I really liked the fact that he like took the time. He said he was getting ready to go on vacation. He was actually like, as soon as he left the hospital, he was on vacation. So it was, I don't know, it was really nice to me that he stopped and took the time to like talk to us and explain this to us, to like keep me from like worrying later or anything like that. So, you know, I really like that, even though like he was basically like foregoing his vacation. You know, most people would be like, yes, I'm on vacation, peace. But he like stopped and took time out of his, you know, schedule, out of his day, his plans, to like make sure that we had all that extra information. So that was really awesome. I really, really appreciated that. So real quickly before I wrap this up, they gave me so much information. So much information, which I pretty much have here. So I mentioned the book before from the cardiologists. They also gave me a folder full of tons of stuff like information and things like that. Then we got another one just from the Fetal Care Center in general, and this is something I really, really liked. They gave us, so it's like this business card sheet, and it's got basically everyone's information in here. From the Fetal Care Center, it's got the social worker, the endoscopic fetal surgery director, which was the guy who talked to us about his atresia. It had the information from the fetal care coordinator, the maternal fetal medicine specialist who originally talked to us about the MRI scans. We got information on everybody that we talked to in the cardiology wing, the Heart Institute information, the Hopeful Hearts for Children, all kinds of different stuff, genetic counselor, something, the thing I was talking about from the Down Syndrome Association with the woman's information on it, and with the Thomas Center stuff. So, oh, and something for like the Center for Breastfeeding Medicine, in case I wanted to like take classes or talk to someone or anything from them. So it was kind of cool that they gave me like this big huge thing with all these business cards for contacts in case I have questions or need to know any of that. Then they turned around and they gave me like, this side is just like pages of like, this one is just websites, just like tons and tons of websites. You know, there's 2 pages front and back, and it's just websites for like resource and information and stuff. There's let's see, there's like some parent stories in here, which is cool. They're all like in their own little packets. Just different like stories from other parents and neat things like that. There's like a little like mini book thing in here as well. And on the other side is there's just some more like information on pediatrics, health. This one's Official Journal of the American Academy of Pediatrics, Health Supervision for Children with Down Syndrome. And just generally more information, and I'm constantly looking for information, so this is super, super helpful. I was very happy that they gave me that. And then I think this may be the last one. I think, maybe. And this, it had some of the same information in it that I've received before, but then it's got information like my state's like information, stuff about Social Security disability, different like resources, and things for like healthcare and things like that. There's also like some packets in here for the Thomas Center and social services and more websites, and then that same like little booklet again. So, and this is where I found that business card that was for the Down Syndrome Association. So that one too. So we ended up leaving with like all these extra like packets and folders and stuff, which was wonderful and therapeutic for me because I cope by research. I'm like, please give me more information. I need to know. And you know, when I get overwhelmed and I'm like, oh my gosh, what if this happens? What if that happens? What if this happens? I'm like, I'm gonna look it up and see how common this is or uncommon, or see, you know, if the information is out there. If there's information about it, then, especially if there's a lot of information, then it's something that like should not be something that I should have to worry about too much, because if it happens, then we'll know how to cope with it, know how to deal with it a little better. Like if it's a medical problem or something like that, the doctors will know how to address it if there's like, you know, it's super common and stuff like that or whatever. But if the information's not out there, then I'm like, okay, well, I need to go and figure this out through the doctors or wherever. I need to go and find this information out. So that's been really awesome stack of material there for me. So I guess that pretty much wraps everything up for my test day rambling. That was, it was a very long day. By the time we got out, it was like dinner time. By the time we left and got home, we basically went home and said, let's order pizza, because we're so tired and been up like since early morning. It's like a half hour, 45 minutes to drive down there. So we were up very early to get ready and then actually make it there by 6:15 in the morning. So that's basically how my day went. It was a very long day, but I am so glad for it, because now I don't have to sit here and ask like, oh my gosh, what are they going to do? How are they going to fix this? How are they going to fix that? How is this going to go? I kind of like know so much more about the surgeries and about how everything is going to proceed and things like that now that we've had that meeting and all those tests done. So I guess that basically concludes everything, and I will see you guys next time. Bye.